At EngenderHealth, we believe everyone everywhere should have the same opportunities to realize their full potential. But we know that not everyone does. Women and girls are held back by both formal and informal discrimination based solely on being female. In many settings, they have less access than their male peers to resources such as food, healthcare, education, and jobs. Sexual and gender minority populations, youth, women and girls with disabilities, and those who are rural and poor are even further disadvantaged. Gender inequality and lack of respect for sexual and reproductive rights have devastating consequences for individuals, families, communities, and countries. When girls and women don't have the knowledge, access, or the respect that they deserve, they can't make their own choices about their bodies and their futures, and we all suffer. But it doesn't have to be this way. At EngenderHealth, we know that gender equality and sexual and reproductive health and rights are deeply connected. That's why we provide access to high-quality contraception and safe abortion, services for survivors of gender-based violence, and other types of care. We have more than 75 years of experience improving reproductive and maternal health care outcomes in more than 90 countries. Today, we are working to advance gender equality both in and through sexual and reproductive health and rights programming. Because we know that when women and girls can access information and services they want and need, free of discrimination and bias, they are better able to make their own decisions about sex and childbearing and to fulfill their life goals, just as we all want and deserve. We recognize that everyone's lives are influenced by the people, institutions, and systems around them. Promoting rights and gender equality requires working with families, friends, faith communities, schools, health systems, and others. EngenderHealth's programs have long been rights-based and client-centered, treating not just reproductive organs, but the whole person. And now we also address the wider context of all people's lives, including women, girls, men, and boys. I've seen the impact of our work firsthand. In a recent visit to Ethiopia, I met Mamite, a farmer who proudly led me through her fields of beets, potatoes, barley, and other crops. She credited her contraception, specifically her postpartum IUD, with enabling her to stay healthy, engaged with her community, and better manage her life and her work. She credited her IUD with improving her crop yields, the supply of milk that her cows were giving her, the ability for her to support her 4 children to stay in school, and the ability to work as a volunteer in her community to help lift everybody up. With our integrated approach, we aim to help create a world in which all people can flourish like Mamite and her family. Gender equality is both an essential element of this vision and a natural product of it. And we can't do this alone. Please join EngenderHealth in catalyzing lasting positive change for millions of women, girls, young people, and their families and communities around the world.